Welcome to the Healthcare IT Today CIO podcast. I'm John Lynn, the founder and chief editor at Healthcare IT Today, and I'm excited to bring you the most practical healthcare CIO insights and perspectives. We know your job is challenging and we want to help you be more successful. And our guest today is Tanya Townsend. She's Senior Vice President and CIO at LCMC Health. Welcome, Tanya.
Thank you so much.
Yeah, so excited to hear about this journey of yours, consolidating EHRs, big effort, and also going after EMRAM stage 7. But before we dive in there, tell us a little bit about yourself and LCMC Health.
Sure. This is an exciting story to tell. So LCMC Health stands for Louisiana Children's Medical Center. However, that is our history, but we don't go by that anymore. It is LCMC Health. We were founded by Louisiana's only freestanding children's hospital, but now since then we've grown into a healthcare delivery system that serves New Orleans and our communities in the Gulf South. We're now 9 hospitals and kept the legacy of children in our name, but we now have many other facilities and we do everything else as well. So we have Children's Hospital of New Orleans. We have University Medical Center of New Orleans, which is the area's only level 1 trauma center. We also recently acquired Tulane University Medical Center and their associated hospitals. Wow. So we are an academic teaching organization training the next generation of healthcare professionals in partnership with LSU and Tulane Medical Schools. And I'll stop there. But we started with the Children's Hospital, but everything else too.
Yeah, no, I don't know if I've ever heard of a children's hospital becoming a health system. I heard of children's hospitals getting, succumbed by the Borgs, but that's pretty awesome. What a cool history.
Right. That's why it is an exciting story to tell. We're the only ones that we're aware of that made that type of transition as well. I am the first CIO of this organization, and I've been in my role now for about 8 years, just over 8 years.
That's so cool. I always love children's hospitals because they come from a different perspective. So I think that's cool. And now the fact that you had children's hospital that became a health system, really, that's quite the story. Well, before we dive into the EMRAM journey and, EHR consolidation, tell us what's the most challenging thing that you're facing as a CIO right now?
Well, this could take the whole time, but
that's true.
Yeah. So we'll talk a little bit about the journey, but yeah, then where we're at today, we face a lot of those same pressures as probably other healthcare organizations, but also just all industries really. We're workforce shortages. We're facing, inflation, costs rising, and reimbursement levels maybe not at that same pace. So we're really challenged on continuing to find efficiencies, yet still invest in technology or the right technologies to help balance all of that. We also we're about to go live actually on a new ERP platform.
Wow.
So, the first part of our journey was getting on an integrated electronic health record, and we sort of, I don't want to say neglected, but we kind of left our ERP alone for a little while, and now we're starting to work through that. So the other side of the fence with enterprise resource planning around HR, finance, and supply chain. So we're just about to go live on a consolidated single system in a few weeks.
Yeah, that's a really big project as well. I mean, similar to the EHR, I don't think it touches quite as many people, but the impact is almost as big. So that's interesting to see you move that direction.
Yeah, definitely. So
cool.
I'm still smiling in a couple of weeks, but
you seem to be doing well. So, you did go through the EHR consolidation project recently. Talk about what's been the impact of that consolidation and what are some of the lessons learned as you consolidated down to the EHR?
Yeah, we had a number of goals going into the project. So because we are an organization that grew through mergers and acquisitions, the hospitals that are now part of LCMC Health all have longstanding history. They had independent IT organizations, independent or disparate, what we would call disparate EHR platforms and systems. So just about nothing was the same. I'd like to say, you name it, I had it.
Got one of these, one of these.
Exactly. And so obviously when you have a environment like that, it leads to a lot of duplication, a lot of inefficiencies, very complex, and a lot of duplication. So our goal was to integrate care. That was step one, was to really integrate care across the continuum, because geographic wise, we are in the same community, all in the community of New Orleans. So patients do tend to maybe start at Children's Hospital and navigate as they become adults. And so we want to have that seamless experience for our community. Also, just improving efficiencies, so making that an efficient process for our patients, but also for our caregivers and our workforce who might be practicing or trying to put the pieces together for a patient that's transitioning throughout those different stages of our organization. So having a seamless experience and improving productivity. And then lastly, getting rid of some of that redundancy and duplication through what we call application rationalization. So getting rid of those many systems that were duplicative of one another really created a lot of efficiencies and cost savings, and allowed us to move to a shared services model for IT. So instead of having 9 independent IT departments, it's now one single department supporting the whole enterprise. So there was a number of wins throughout that process.
Yeah, that's impressive. I mean, when you think about the independence of each hospital and kind of having their own independent IT department, did you bump into some kind of fiefdoms, if you will, and things you had to navigate to be able to really consolidate to that shared services model?
Absolutely. It's a journey. We're probably still, I wouldn't say we're done with that journey just yet. But yeah, it's definitely a bit of a change in culture. Because there was a lot of independence. And when you have a single system that you don't have to share with others, you get to make decisions a little more swiftly potentially. But now we have to have a shared platform, shared system, shared resources. So we had to put a lot of governance in place to ensure we were making standard decisions wherever possible, and making those or making the argument for having adjustments along the way. So obviously pediatrics is an area that is different than adults. So that's usually where we might have a difference in how we approached it or how we built the system. But in general, we had to come up with a governance model to get all the right decision makers and key stakeholders to the table and help us make those decisions. So, but yes, we definitely experienced a little bit of that fiefdom and transition along the way.
Sure. Well, it's easy for them to just be like, well, you're pediatrics, so we can't. I can already hear the meetings. So yeah, having good governance it's interesting. It's key regardless of, what your past history is. So it makes a lot of sense. Well, as part of this effort, 2 of the LCMC hospitals achieved HIMSS EMRAM stage 7, which is a pretty impressive feat when you look at everything that's required to do that. Can you talk about why was this an important effort for your organization to really go after, becoming an EMRAM stage 7 hospital health system?
Yeah, I think it's number one, it kind of gives you a little bit of a map to use to help guide, the maturity and progress. It also is just an opportunity to benchmark with your peers. So what are others doing? But what I really like about the EMRAM model is it's about how well you're using the system. So it's an opportunity to showcase not just that we put in some technology, but what we did with the technology. So it's one thing to turn on some buttons, but the EMRAM model really measures your outcomes, measures how well your users have adopted the system and the results that you've seen around, we did a lot of measuring around quality and safety and now we have so much data at our fingertips. So it really helped us to measure our success versus just, we got live. That's usually usually during the very early stages of an implementation, you measure yourself by on time and on budget.
It got turned on. They're using it.
But now it's really, okay, well, how do we use the data and appreciate our success with the system, and having some goals established to really showcase, again, what we've done with the system.
Yeah, and I think that's been the evolution of EMRAM, is more towards those outcomes based, opportunities, and showing that it's actually impacting outcomes rather than just, oh, you implemented this, right, or whatever it might be. Did you also use EMRAM as a way to kind of motivate the employees or to get buy-in from leadership? Did you use it that way? Because I've heard a lot of people using EMRAM that way as kind of this, goal that you could use with the team to be able to drive success, and then obviously achieve an award, which is always good to get some recognition. Did you use it any of those ways, or?
We did. Definitely to seek, we, in our governance model, we tried to say we want to be operationally led and IT supported. So I think this EMRAM model really helped support that vision of, operations and IT really partnering to achieve goals. It helps to educate IT folks that might be new to healthcare. So it helps them understand what are we measuring and why, and it just helps them approach their day and what they're building and supporting in a different perspective than, again, just kind of turning things on. We did use it as an employee engagement opportunity. So it's great when you get to have an award. It can be motivating. It just helps you appreciate your hard work and that it paid off and that it's being recognized. So we did have it on our engagement.
Yeah.
Goals and vision as well.
Sure. Celebrating success is key for employee morale, especially these days with all of us burnt out. So were there parts of the EMRAM that maybe you wouldn't have implemented right away if they weren't part of this larger goal of becoming a stage 7 hospital? Or, how do you look at some of those things? Because some of them are pretty heavy lifts. I mean, we're not talking, it's not a little cakewalk to become EMRAM stage 7. So were there things that you looked at and you're like, yeah, well, we're doing this because it's part of the stage 7 requirements?
Yeah, not so much, whether we would do it or not, but the metrics are pretty high. So, which makes it a little bit more difficult to do. So the higher the metric requirement, the more challenging it can be. But there was nothing that we said we didn't believe in or we didn't agree with that being something that we should pursue. So for example, it's the right thing to do for patient safety, but having, 99% barcode medication administration compliance is hard to do, both from the technology standpoint, as well as the workforce education and accountability, and making sure you have all of the tools and processes in place. That's really difficult to do because the bar is so high. And the other one that's like really difficult to do, surprisingly, is getting rid of paper. You would think with an electronic health record, we're capturing everything digitally at the point of care, and we don't have paper anymore. But believe it or not, there's still a lot of printing, a lot of faxing, a lot of just one-off pieces of paper that make their way into a patient's stay. And so having that either scanned in and made available real time is tricky to do as well. So I wouldn't say we wouldn't have done that, but it is a little more challenging to do. Again, having the technology in place, having the processes in place, and making sure that everyone's compliant with it.
Yeah, the scanner business is a good place to be. And EHRs are paper generating machines, right? A few clicks and you can generate a lot of paper. So kind of ironic.
How much we still do.
No, I mean, I was looking around my desk at some of the paper that had accrued just this morning. And I was like, where did all this come from? I'm so digital. But then I wondered, is my digital life a mess the way my desk is? But anyway, something to think about as we look at our EHRs probably and ERP systems. But, looking forward, what's next on the roadmap for LCMC Health?
Well, I kind of mentioned the ERP. That's our next big thing. Cybersecurity, of course. I know that keeps all of us CIOs up at night and trying to stay on our toes and being able to continue to advance what we need to, because the cyber criminals of the world keep getting smarter too. So making sure that we have a good posture and maturity around cybersecurity. The other thing that we're working on is access. So not only do we need to continue to focus on clinician efficiencies and the clinician experience? Now we have a focus on the patient experience. And I wouldn't say one is more important than the other. So keeping both of those things very much in focus. On the clinician side, of course, there is the workforce shortage and the burnout, et cetera. So how do we continue to make their experience as efficient and joyful as possible? And then on the patient side, we do realize that we're entering this world of consumerism, and patients have a choice and they want easy access. So we're doing a lot around just making the patient experience easier to enter our system and then to stay in our system, both through our patient portals and a variety of tools that they can even use, like remote monitoring, for example, from home, and telemedicine. So that's a big area. And then the other area, I kind of touched on it briefly earlier, but revenue cycle. So the reimbursement models are always changing, and I know it varies from state to state and community to community, but trying to stay on top of the reimbursement models and ensuring that we can continue to afford both the inflation expense rises, but also ensuring that we're getting the revenue that we need, and partnering with payers, et cetera, and understanding that model as well. So we're doing a lot around that. And then data analytics is the next piece. So now we've got so much data available. How do we leverage it and use it and measure the right things? So moving not only from analyzing the data, but also becoming a little bit more predictive with it as well. So how can we use this data to predict outcomes and potential deterioration and social determinants of health. So we're doing a lot in those spaces as well.
So really, you don't have much going on, is what you're saying.
I know.
That's a lot, right? You think about all the different areas, right? And I love that you love with cybersecurity, because it never is going to stop. I think that's the challenge there. It's interesting when you talked about patient experience. I came from the Qualtrics conference, which is all about patient experience, and one of the people talked about, hey, healthcare is focused on quality for a long time, right? And lots of efforts to improve quality and the quality of care that's given. We've also spent a fair amount of time on revenue cycle, right? I mean, you look at all the revenue cycle companies to ensure we get paid. I think you're right. It's changing, right? As patients are responsible for more. He's like, we didn't spend enough time on patient experience, and we need to do that now, right? Which I thought was interesting. It sounds like you're going through a similar path.
Yeah, absolutely. I do think the first, I'll say we've been working on EHRs my entire career, which is a little bit over 20 years. Uh-huh. And I would say the first, 10 to 12 years was really just digitizing, the paper record, and a lot of focus was on the clinician experience, particularly because up until 2008, 2009, CPOE, computerized physician order entry, and evidence-based medicine wasn't fully bought into until meaningful use came around, and then everyone decided that it was the right thing to do, which is unheard of now because it's just so natural that we do those things now. But that was a big focus that first 10 years or so of my career. And then, now it's like, well, that's still important. We still need to do that in order to recruit and retain, the top talent that we need. But we also now have this focus on the patient, because they can choose. They can choose, and they want to be able to access care immediately and efficiently and quickly, because they do have a choice now, and making it transparent for them to understand how to access the system, what their bill might look like, how they can communicate with us and their provider, and what they can expect. Like that's just a standard expectation from patients now too.
Yeah. Well, and it was also interesting to hear them when they talk about focusing on the patient experience, that if we get it right, there's a trickle down effect impact on the staff as well. Because if they're not pissed off that there wasn't an iPhone charger in your ER waiting room and they couldn't charge their phone, now they won't be quite as angry when they get to the nurse and the doctor down the road. So it's interesting how they're intertwined, right?
Yeah. You're right. I'm going to tell a quick other little story. So we just did a big project this past year to revise our online scheduling capabilities. Mm-hmm. So prior to this project, it was a little bit more I would say, clinician focused, in that they were able to control their schedules a little bit more. And we kind of had some blocks in place of a patient traveling throughout our system and trying to keep the patient at that particular provider or clinic. And we just revised that whole model to make it more open, so open access for our patients, that if there is an unavailable provider within that service line, they need to be able to schedule into that appointment and get in, when they want to get in. So that was a little bit of a culture shift as well. But not only are the patients happier since we revised this model, but everything went up. So volumes went up, patient portal sign up went up, schedule utilization went up.
Wow.
Yeah, so it really did go hand in hand. Not only were the patients happier, but we got increased volume as a result as well, which again just helps us to remain in the community and see more patients.
Yeah, that's a great story. And I think you just described what I would call like a CIO eternal truth. Sometimes you got to implement something halfway so that they can see, so that you can get to the full way, right? Like I did that in the first EHR we did. We implemented just the charge capture. And then the nurses and doctors started complaining, well, why can't I just do the rest of it here? We're like, really? Yes, of course.
Yeah, I've had to learn to become patient. So, when we were designing this system, it wasn't like we were intentionally saying, well, we're going to keep this pretty closed. But back to that culture piece, not everyone was ready for that. I mean, that was like real change, and weren't necessarily ready, 4 years ago, but we're definitely ready now.
Yeah, I love that. And a nice CIO eternal truth. Be patient.
That's my word of the year, patience.
That's a good life lesson. Well, we always like to finish up these CIO podcasts with a little bit of career advice and some thoughts and perspectives. You have 20 years working in this area. So what advice would you offer someone who would like to be a healthcare CIO like you?
Yeah, I would say get involved in whatever network in your industry. So I personally am I'm actually on the board of CHIME, the College of Healthcare Information Management Executives, and I've been a member since 2006. And it's just a great avenue for networking and talking to peers, and you don't have to be a CIO to be in that organization. So there's just so many different tracks you can learn from. And whether that's CHIME or something else, I would say get engaged and find those peers in that network that you can communicate with, and staying abreast of what's happening, through things like this, like podcasts. And then the other piece of advice, if you're working on just IT leadership or CIO track, is to really understand that value on partnering with operations, or really aligning the technology strategy with the organizational strategy, and collaboration is the key.
Yeah. I like that. I mean, I think there's so many tech guys like me that just want to implement the tech solution and not necessarily look at the business side. So that's really good advice.
Mm-hmm.
Awesome. Well, thanks so much, Tanya. I appreciate you taking time to share these insights and perspectives and the experience, and congratulations to you and your team on achieving the HIMSS EMRAM Stage 7. And thanks everyone for watching and listening. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for the CIO podcast by Healthcare IT Today on your favorite podcast application. Thanks, Tanya.
Thank you.